It is important to talk about workload for professionals in lung cancer screening because we're having a globally rising medical imaging market by around 5.4% annually. Also, the numbers of cross-sectional imaging are increasing annually by about 3 to 7% worldwide. And also, availability and higher medical standards are one reason for that. And screening could be also another reason. So we asked basically, does lung cancer screening add up on this? If the workload of lung cancer screening professionals is affected by these changes, we wanted to evaluate by a survey specifically conducted for professionals with about 42 questions in 6 subtopics. It was evaluated by 37 SOLACE partner sites. And within SOLACE, we distributed this survey specifically to lung cancer screening professionals in the year 2024. And we received responses from 14 countries, specifically also from SOLACE lung cancer screening centers, but also from research partners from important and big lung cancer screening studies, such as Nelson, For in the Long Run, and Hanse, for instance. And we saw that about 66% of the respondents reported an increased workload by lung cancer screening. Often because it's additionally to the daily routine. So the lung cancer screening adds up on the daily work. One other point is that the time slots for lung cancer screening are shorter than for normal chest CTs. That contributes to consolidated workload. And we also found that as more CT per week you do in a department, as less time you have to perform lung cancer screening. So what can be challenges associated with this increased workload in lung cancer screening? One problem can be or could be that professionals could feel overworked, overwhelmed by this additional workload. However, in our study, we found that only 20% felt overworked and 80%, so the majority of respondents, did not feel overworked, although there seemed to be this increased workload. We also evaluated and correlated the feeling of being overworked with other factors that we assessed throughout the survey. For instance, individual support of lung cancer screening training, or the amount of hours you work per week, and we could not find significant correlations with any of these factors. Potential benefits for healthcare workers in lung cancer screenings can be an increased expertise throughout focused reporting, because we could see that the participants, since the introduction of lung cancer screening, show more focused reporting on chest CTs, and reportedly 85% responded that they felt actually this increased expertise by focused reporting. Supportive factors for professionals in lung cancer screenings can be twofold. So on the one hand, we have the lung cancer screening training. Over 50% of our respondents actually received a dedicated lung cancer screening training. And we could show that there is slight positive correlation with diagnostic confidence and previously received lung cancer screening training, which is a benefit and a supportive factor. And on the other hand, we have AI. Not just meaning AI, but specifically nodule assessment programs. 68% of the respondents use AI and/or automated nodule assessment programs as a support. And almost 80% feel more diagnostic confidence by that. But moreover, 93% feel supported by these programs.